Craig Ward from our marketing department is in here with us this morning. And Greg, today our business of the day, I guess you know, is Dr. Frank Hayward at Heartland Spine here in Cape Girardeau and Marion, a neurosurgeon who can help make the pain go away. Dr. Hayward will evaluate your spine and spend the time needed to see that you thoroughly understand your condition and treatment options. And there are options. Heartland Spine Center, changing lives, saving lives. And you got somebody in here with a special guest today.
That's right. Yeah, I had a pleasure of talking to John Felter last week, and excited to have him in here to kind of talk about Dr. Hayward and his experience with him.
I've known John a long time. John, how long have you known Dr. Hayward?
Oh, I would say probably 3 years, maybe.
3 years. How did you get to know Dr. Hayward?
My wife works at St. Francis, and she works with him.
Okay. Okay. Have you used him?
Yes, he's done 2 surgeries for me now.
Is that right? On
Yeah.
on your spine, on your back?
Yes, he did one on my cervical up on my neck, and one on my lumbar down lower back.
And you had all kinds of pain with that
Oh,
beforehand.
yes. The last one I had was lumbar, and the pain, it was pinching a nerve. It went down my legs, and it got to where I couldn't hardly walk, to tell the truth.
Oh, man. And he did surgery both times on
Yes,
you there.
Mm-hmm.
Yeah. I guess he tried other things, methods and what have you?
Yes, he recommended different options for me, and this was tried to use it with medicine for a while, and it just didn't quit. And he did give me a lumbar puncture shot, which helped for about a month, but it just didn't take care of it. And I could have had another one, but I elected to go for the surgery.
Right. How long did it take you to get over the surgery the first time?
Oh, the one on my neck, it took probably a couple months, actually.
I have a lot of therapy?
No, not really. I had to wear they call it a bone stimulator, which is works off a battery, and it puts electrical impulses on the back of your neck.
Okay, so now is that an external thing, or do they have to implant that?
External deal,
Okay.
yeah.
Did it work good?
Yeah, I did. It's surprising. I had to wear it 4 hours a day for 4 weeks, I think it was. And yeah, in the end, you could really tell it did make a difference.
Now, how does it work, John? Do you push a button when the pain's there, or
No, you can wear it for 1 hour. You have to wear it for an hour. It's computerized, and after the hour is up, I could shut it off and turn it on. But you don't feel really anything. You can hear a slight buzz or something, once in a while when it is on. But
the pain goes away.
Mm-hmm.
And how long does it last usually?
Well, with this stimulator, it was just one of the healing processes.
Okay.
What he had, and then on the second surgery I had August the 5th, I think it was. He
This year?
Yes, sir. And he had died. Said I was going to have another one back in the spring, and anyway, he decided to have another MRI done 2 days before was scheduled for the surgery. And after he seen a new MRI, he decided just to do a microdiscectomy, which is shaving off the bone that was putting pressure on the nerves to my legs. And
well, looks to me like you got over that real quick.
yeah, he told me it would take till about the 1st of October, and it has. I'm really doing well now.
What are you doing now?
I'm a self-employed farmer.
Yeah. So you going through harvest right now?
Yeah, we sure are.
How's it looking?
The beans are better than we thought, or the way they look. Corn wasn't quite as good as we thought. Yeah, we got corn out and working on beans now.
Yeah. This weather's really hammered you.
Yeah, we was expecting to get 3 or 4 days of good weather this week, but it doesn't seem like we will.
John, will the quality of the beans go down?
Yeah, they will if we get a whole lot of moisture or rain. Yeah.
Well, you heard that forecast a while ago. I'm hoping the weather people are wrong.
Yeah,
Hopefully
right.
that thing goes. Somebody else gets it. It needs it, because we sure don't need any here in this part of the country. How were you treated there with Dr. Hayward?
Oh, excellent. He takes the time to talk to you. Whenever I had an appointment, he would ask me what I wanted to do, and really diagnosed it well. And in the end, I mean, he was exactly right on what he told me.
Right. You'd recommend him then?
Oh yes, to anybody. In fact, I've told people already about him that that he really cares about you.
Yeah, it's obvious. We've had him in here, and I was really impressed that he's just a down to earth person.
Right.
That kind of puts himself in the patient's
Right. He
seat.
sure does. In fact, he told me, he said on one diagnosis, he said, this is what I would do. He just up front told me that, you know.
Yeah. Yeah.
But,
so, and you found the staff the same way?
Yeah. They was excellent. I had real good nurses. I think I had a 2 or 3 day stay that I was in there, you know. But yeah, they was excellent.
Right.
His office help are excellent. I mean.
Yeah, and of course he's located in the Healing Arts Building in the San Francisco Medical Center here in Cape Girardeau. Of course, he's got a location over in Southern Illinois, Pain Management there in Marion, Southern Illinois Pain Management. Now, do you know what days he's over there, Craig?
He switches it up like every other Tuesday and every other Monday.
Yeah. So anybody over in that part of the country, instead of you having to drive to Cape Girardeau to see him, you can, I guess they could call him and find out the days that he's going to be there.
Yes, they can.
Do you have a number for him?
Yes, I do. It's 573-331-5761.
Okay. Give him that number once again there.
573-331-5761.
Now, what about the one here in Cape Girardeau? What?
That's the number for both.
Oh, that is the number
yeah.
for both. Okay,
Mm-hmm.
All right. Well, I should have recognized it, 335. But call him, and, you know, John, one thing that I was impressed with him is how he grew up, what decisions that made him want to be a doctor, and his Christian values.
Oh yeah, he's really got Christian values. He
And,
sure has.
you know, I have been told this by somebody that has used him, that he had prayer before and after each surgery.
I didn't know that.
And I had been told that, and I don't think you told me that, but somebody else told me that.
Mm-hmm.
So you know, when you got a person like that, you can have pretty good confidence in him.
Yeah, that's exactly right.
But you know from proof,
Yeah.
you've used him 2 different times there.
Yeah.
So are you getting around pretty good now?
Yeah.
Are you absent of pain?
Yeah, I'm absent to pain. I can tell if I do quite a bit of physical work, it'll show up a little bit, you know, back work or something. But
You've just been 2 months since you had
Oh, that's
surgery.
right. That's right. That's what everybody tells
Are
me.
you running the combine?
Yeah. Mm-hmm.
Man, oh man, like nothing. Of course, John's pretty tough anyway.
I think I am. I don't do a lot of the jumping high stuff yet, but you know.
And jumping off of the combine instead of going down the steps like you're supposed to.
That's right. That's right.
How much can you lift now, John? Are you restricted on that?
I watch it. I don't try to lift over 40 pounds or so.
Yeah.
You know.
Yeah. Well, you ought to stick with that from now on.
I think I'm going to try to. Yeah.
Because when you get 50, you need to slow down a little bit.
That's right. That's right.
That's what they say anyway.
That's what they say.
Retirement's not in your vocabulary, is
Not
it?
yet. No.
You've been farming all your life?
Yeah. Sure
Yeah,
have.
yeah.
Yeah.
Well, I hope this year's an abundance.
I hope it is too.
I hope those grain bins and those hoppers just overflow with harvest.
right.
So corn didn't cut as good as you expected it to.
No, ours didn't. It was down about 20 bushel, I would say.
What do you think caused it?
We had a dry spell there, late spring, I'll call it, and then some of it was planted a little later on account of the wet spring. In fact,
Right.
some of it was replanted, and it just didn't quite, make it as much.
Yeah. Didn't do what you expected it to do.
Exactly, yeah.
But beans are doing pretty good there.
Yeah, real good. So.
Last year we had a good bean year, and I was hoping it would be a repeat of last year.
Yeah.
And it looks like it would be if we get this rain to stop.
Exactly.
But was any other comment that you'd like to make about Dr. The surgery that you had with?
No, I would recommend him to anybody. I sure would.
All right, and if you want to talk to John, we'll catch him when he's taking grain to the elevator, whatever, and he can tell you. But Dr. Frank Hayward, Heartland Spine here in Cape Girardeau and Marion, neurosurgeon that can help the pain go away. He'll sit down and talk with you and look at options and try to treat it without surgery. But there comes a time when there's no other option.
Right.
And but Dr. Hayward, he will evaluate your spine, spend the time needed to see that you thoroughly understand your condition and your treatment options. Heartland Spine Center, changing lives, saving lives. John, I appreciate you coming in and taking your time with us to spend this morning talking about your experience with Dr. Hayward. And may get out there and watch you run the combine one day.
All right, Bill, anytime.
All right, man. It's good to see you, and good luck and take care of yourself.
Okay, thank you.
So you don't wind up seeing Dr. Hayward again.
That's right.
All right. John Felker there. Thank you so much. Appreciate it.